what we've been talking to a lot of hospitals about is, well, really the first step is the data integrity. Again, states have not necessarily communicated with some of these people in 2.5 years. So as we know, people have moved around. They might have a new address or a new telephone number. And if states don't have the best contact information to send these letters to, or to conduct their outreach attempts, it could fall on deaf ears. So what we're talking to hospitals about is, as a first step, run some type of data integrity. If you have access to a skip tracing tool through like a LexisNexis or something like that, that could be beneficial. In many cases, we expect that hospitals will have better data than the states do, because they've seen these people more frequently or more recently than the Medicaid offices have interacted with them. But I would say the first step would be try to scrub that data for good contact information. Once you have that good contact information, as I mentioned before, using omni-channel outreach, text messaging, emails, just really any channel that you can use to reach out to these people. A light touch could just be an educational message, letting them know that the PHE has been lifted and there's action required on their part to maintain their coverage. Maybe a reminder to look out for notices from Medicaid, something like that. And then, as I mentioned before as well, offering that high touch advocacy. If you're able to provide resources to talk to your Medicaid population, that could be really helpful in making sure that they're educated and able to go through the process of re-enrollment. The other part I would mention is how you segment your outreach efforts. Some of these hospitals in rural areas might be seeing the same patients over and over. That might be a higher priority to try to reach out to from a high touch perspective than, if you saw a patient maybe 18 months ago and they haven't been back to your facility. So those are just a few things that we're talking to hospitals about, and offering our support as much as we can to be able to assist through those efforts. Look, I live in a rural area, so I experienced this. My daughter's a type 1 diabetic, and she was diagnosed last summer. And when we had to take her to the hospital, we had to drive an hour into, a bigger city where they had a children's hospital. So access to care is to me what this is all about, and making sure that people in a rural community have access to care. I saw a release that since 2010, 138 rural hospitals have closed. And with the public health emergency and funding issues, budget issues, things like that, I think that this is CMS's attempt to make sure that rural hospitals are not closing and that they're staying open and able to even expand patients' access to care. Which, if you live in a rural community, which I think 1 in 5 of Americans do, that's something that probably would resonate with you as a consumer of healthcare.